Well, good morning, everyone. Thank you so much for joining us on this rainy Friday morning as we discuss early learning and childcare and its intersection with advocacy and business. I want to announce that this meeting is being recorded right now. I'm Deb Jones. I'm the Director of Community Initiatives at United Way of Lancaster County. Typically, our monthly virtual community conversations are hosted by our CEO and President, Kevin Ressler. He sends his regrets in not being able to join us this morning. Well, as many of you know, United Way is a strong supporter of early learning and access to early learning. And so we are delighted to host this presentation and panel of esteemed colleagues in the field. So I want to give you an overview how our 90 minutes are going to play out. We're going to start with a presentation that will discuss the struggling families who are trying to get ahead during this time. And then we're going to move into a panel discussion, and we will wrap up our time together here at 10:30. So with that said, I would like to introduce Rebecca O'Shea. Rebecca serves as the Advocacy Engagement Coordinator with United Way of Pennsylvania. Rebecca, thanks so much for being here.
Yes, thank you, Deb. And I'm going to go ahead and share my screen to go through this presentation. Hello, everyone. As Deb said, my name is Rebecca O'Shea. I am the Advocacy Coordinator at United Way of Pennsylvania. I am also the project manager for our ALICE project. So who exactly is ALICE? ALICE stands for Asset Limited Income Constrained Employed. And essentially, it is the population that is above the federal poverty level, but below financial stability. The way that we measure ALICE is through the survival budget. It is a good measure of the cost of essentials, but it truly is not sustainable. And you'll see that in the numbers when I go further into the presentation. We also have a second measure, which is the stability budget. And it's a little bit better measure of what it truly takes to sustain a household in Pennsylvania. With this all being said, United Way of Pennsylvania has strived immensely over the last year to lift up this ALICE population because they are often forgotten. Again, they make above that federal poverty level, but below financial stability. So they often do not qualify for government assistance programs. So United Way's goal is to engage businesses, government, and nonprofit partners to work on solutions to help this ALICE population. And one of the solutions is definitely making childcare affordable. So who is ALICE? In Pennsylvania, it is nearly 1.4 million hardworking Pennsylvanian households, or 27%. Again, they are making above that federal poverty level, but still not high enough to pay for their basic needs. When you combine that population with those living below the federal poverty level, so those in poverty, you're seeing about 2 in 5 households that are struggling to survive, nearly 2 million, or 39%. And this is just in Pennsylvania. So for the ALICE survival budget, the way that we estimate the minimum household essentials is through breaking down the budget into very necessary household items. So you're talking about housing, you're talking about childcare, you're talking about transportation, healthcare, and taxes, all kinds of things that make up the household budget. We break out to estimate the minimum cost that you need to make per month to cover all of those basic needs. And when we compare that to the federal poverty level, you can see that our ALICE survival budget is nearly double that on the federal poverty level. In instances of a family of 4, it's triple that. We also have a senior survival budget. The senior survival budget shows that seniors spend their money a little bit different. So you're seeing lower food costs, you're seeing traveling fewer miles, but you're seeing more being spent on health needs. This is a really essential portion of our survival budget because Pennsylvania does have a large senior population. So the more data that we can get to understand how our Pennsylvanians are living, the better. So when you break down the budget, this is a wonderful graph. I love showing this graph. It shows how things stack up. So when you look down here, you have the federal poverty level for one person. You have the typical job and income for a Pennsylvania Alice household, which is about $11 an hour, and that's a retail salesperson. And then you can see how the survival budget stacks up for that household. The other thing I like to point out with the Alice survival budget is that you can see it is incredibly conservative in its estimates. For instance, housing for a single adult at $640. I'm a single adult. There's no way I can find rent for that, not even in a studio apartment for where I need to work to get my job done. So this shows that even with these conservative measures, you're still getting nearly 30% of the population that's struggling to survive. Same for the household, if you family of 4. For childcare, that is a conservative measure, and we'll probably talk a little bit more about this in the panel of what it actually costs to have childcare. $1,200 is a conservative measure, but it is the largest portion of a family of 4's budget. One thing that we like to talk about with Alice is the Alice Essentials Index and compare it to the Consumer Price Index. In the news, you are hearing a lot about inflation. You're hearing a lot about shortages. One thing that is important to note is that the Consumer Price Index, which measures inflation, is not fully giving the picture of what it actually costs to survive. So to kind of answer the missing parts of the CPI, we have created the Alice Essentials Index, which shows again it calculates what actually goes into a household budget. So it's including the housing, the childcare, the food, transportation, healthcare, and a smartphone plan, which, as we know, over the last year has become very essential for many families to have a smartphone plan to access resources. You can see here that the Alice Essentials Index over the last 10 years has increased substantially and has doubled that of the CPI, which again just shows that cost of living is going up and our Alice population is struggling to survive. We also like to break Alice down into the economy and what it means for our economy when we have this population that is struggling to survive. One thing that is important to know, in the last decade, low-wage jobs in Pennsylvania have increased by 76% compared to high-wage and medium-wage jobs. This is significant because at United Way of Pennsylvania, we are constantly advocating for family-sustaining incomes. This is important to note because family-sustaining incomes could look like childcare subsidies, could look like tax credits. It could look like many different things. We are fine with whatever solution you come up with, but we just need to point out that there are no family sustaining wages in Pennsylvania at this moment. So that's just what this graph is showing here. For the pyramid graph, you're seeing that our economy is broken down into 2 different types of workers. You have the innovators and the maintainers. The backbone of our economy are the maintainers. So you're looking at the nurturers, the infrastructures. These are people that work those essential jobs to keep our economy moving during the pandemic. So you're looking at food service workers, you're looking at childcare workers, our lower end healthcare workers. All of these people serve essential roles throughout the pandemic and continue to serve essential roles throughout the pandemic, but they are struggling to survive. That is our Alice population. So I talked a lot about the survival budget. Now this is the stability budget, which shows a little bit better estimate of what it costs to be financially stable in Pennsylvania. So you're going to see estimates of higher costs of maintaining a viable household. You're going to get a little bit better housing. You're going to get a little bit better food quality, more spent on transportation, but you're also going to get a savings account. That 10% savings is essential for emergencies. We like to say that Alice is one emergency away from falling into poverty. And when you've had an entire year of emergencies, when the new data refreshes, we're going to see that this Alice population has increased substantially from the pandemic. So if you look at the numbers, you can see here for 2 adults, 2 in childcare, childcare is the largest expense. aside from taxes, with $1,500 being spent on childcare for two. You're also seeing, looking at housing for a family of four at about $1,000. That's still a conservative measure. So although these stability budget numbers are larger than the survival budget, it still is conservative. My favorite thing is to go back to housing. I think most of us have a good pulse on what housing costs are. And I can tell you $1,000 a month, it's rare to find that for at least a 2-bedroom household. So when we talk about ALICE, we like to talk about what would lifting all ALICE households to the ALICE threshold and above. You're going to see an economic boom occur. You're going to see $130.2 billion being added to the Pennsylvania GDP each year. You're going to see that multiplier effect. Basically, what this graph is saying is that when you make our middle class strong, you're going to reap the benefits all across the economy. ALICE households, they do not hold on to their money. They must spend it to survive. That's going to continue. They're going to invest into their local economies, which again impacts the larger economy and benefits Pennsylvania as a whole. So I talked a little bit about how COVID-19 and ALICE have been impacted. United Way of Pennsylvania conducted 2 surveys in the last year and a half, 2 years now. The first survey we conducted in August of 2020, which was a 6-month marker of the pandemic, with the pandemic starting in March of 2020. Then the second survey we conducted in March of 2021, which is a 1-year look back at the pandemic. The following slides are going to be the results from those 2 surveys, and you're going to see some very interesting things and a definite divide between this ALICE population and those living above ALICE. So for the top needs, you're going to see that 70% of respondents indicated changes in employment, including loss of job and being temporarily laid off. You're also going to see that 77% of respondents had 1 month or less of savings to cover basic household needs. That second point right there is essential to this ALICE population. I said that ALICE is one emergency away from falling into poverty. When you do not have a month of savings, you are going to fall into poverty because of the situation that the pandemic created. You're also seeing that those living below the ALICE threshold had concerns about paying for housing. That was a large concern for a lot of people and continues to be a concern moving forward in and out of this pandemic, however you want to describe where we're at in it. ALICE households also report experiences with food insecurity, lack of internet access, and concern for childcare and distance learning. Childcare is on these families' minds, and the more that we can do to assist these families to access childcare and have affordable and accessible childcare, the more relief that we are giving to these families. For the March 2021 survey, you can see how the concerns continue. So you're getting this huge divide between paying for housing expenses. This is a significant divide that we continue to see with this ALICE population. You are also seeing a rise in mental health issues, and you're going to see this come out a lot over the next year, how mental health, there is a concern for mental health, not just for parents, but for their children as well. This pandemic, again, it created a lot of instability for not just families and their working environments, but also for their children. And that includes children who are in childcare. United Way of Northern New Jersey, who is the parent of the ALICE project, recently released a COVID-19 pandemic report from the national level. So these are some results that came out of that report that I just wanted to call to your attention, because it is continuing to tell this story that ALICE is struggling to survive. So you can see here they divided it up to below the ALICE threshold and above the ALICE threshold. 42% of those living below the ALICE threshold were struggling to get by, compared to 9%. 17% quit a job due to childcare, compared to 3%. 60% lost income, compared to 40%. Sorry. And 68% had no rainy day funds compared to 29%. And then again, you're seeing here elevated symptoms of anxiety and depression, and that is universal across all household structures. So these are just some things to think about when we are policymakers and when we are working towards advocacy, to just be mindful of this population, because again, in the beginning, I said they often get left out. Most of our programs stick around that poverty level, but ALICE makes above poverty level. So you're missing an entire population with a lot of the services that we provide from the government. Other than that, that's everything that I have. Thank you all for listening to me. This is my contact information. If you want to know more about ALICE, all of this information is accessible. We have two websites. We have uwp.org/ALICE. That is United Way of Pennsylvania's landing page. On there, you get full reports, all of that. And then we also have the more data heavy, which is unitedforalice.org/Pennsylvania. So all of this data is accessible and for you to view. And if you have any questions, feel free to reach out to me. Thank you.
Thank you, Rebecca, for sharing the presentation with the data that helps us to be able to see the great need. Can you tell the audience a little bit, when will that data be refreshed? I saw that it was 2018.
Yeah, so we were initially going to refresh next year. With the pandemic, things kind of changed regarding the data. So a large portion of the data comes out of the American Community Survey. The government has, the Census Bureau has deemed the ACS, this for 2020 to be quote unquote experimental. So we're not quite sure what that data is going to look like. We don't think it's going to be fully encompassing of what this ALICE population is, but that 2020 data will be available early next year on that United for ALICE hub. When United Way of Pennsylvania does an actual refresh of our report and does a whole rollout, that's going to be in 2023. But with that being said, we have a lot of great things planned for next year regarding advocacy around ALICE. So follow us, check us out. You're going to see a lot coming out.
Okay, thank you, Rebecca. If you don't mind putting the website into the chat for everyone to have access to, we're going to have an active chat that's being monitored right now, so feel free to put some questions in there. Also, we're going to go into our panel discussion right now, and because we have a large panel, we were asking others to just hide their camera, turn the camera off, so that we can then have less interference with our panel discussion. So thank you all for being here. For those that have joined us in progress, we're really glad that you're with us. As we move into our panel discussion, I just want to have the speakers introduce themselves. So I'm just going to call out your name and please share introduce yourself here. So Kimberly, let's start with you.
Hi, good morning, everybody. Kimberly Earley. I'm the Director of Public Policy and Advocacy with the Pennsylvania Association for the Education of Young Children. We're the state affiliate of the National Association for the Education of Young Children, and our mission is to be an effective voice for high quality early childhood care and education, and we do that through policy development, advocacy, professional development, and also supporting early childhood professionals. So our vision is that all families have access to high quality, affordable early childhood care and education opportunities for their children that's provided by a profession that's well valued, well compensated, and supported.
Thank you. Stacy.
Good morning, Stacy Blake. I'm CEO of YWCA Lancaster. We are one of 18 YWCAs in Pennsylvania, and there are over 200 YWCAs across the country. Most of us offer childcare programs and serve, hundreds of thousands of children across the country every day. So I bring you greetings from the She session, as we say, because we know that what's been happening the last couple of years has had a disproportionate impact on women and childcare access, affordability, and being open is part of the challenge that we're all facing. So I look forward to speaking with my colleagues this morning.
Thank you. Rebecca, can you share a little bit more about United Way PA?
Sure. So United Way of Pennsylvania is the state association, and then local United Ways such as the United Way of Lancaster County are a part of our membership. At the state association level, we do a lot around public policy and advocacy. We are often meeting with legislators, and of course, we house the entire Alice Project. We also house PA 211, if you've heard of that. It's to a call line to get resources and connected with information. The state association houses that as well. So,
Thank you. Steve.
Good morning, everyone. My name is Steve Doster. I'm the Pennsylvania State Director for Council for a Strong America. Council for a Strong America is an umbrella 501c3. We operate 3 organizations in Pennsylvania, or 3 brands, if you will, that mobilize non-traditional partners in this discussion around early care and education. So behind me, you see our Ready Nation brand, which speaks to the business leader voice and the importance of early care and education investments from a business perspective. We also have a mission readiness brand, which brings in the voices of retired military leaders, generals and admirals. And we also have a third brand called Fight Crime, Invest in Kids, which mobilizes Pennsylvania's law enforcement leaders on behalf of early care and education. So it's a pleasure to be here. Thank you.
Thank you. Tyrone.
Good morning, everyone. I am Tyrone Scott. I'm Director of Government and External Affairs for First Up out of the Philadelphia area. And our organization is a chapter of PennAC, so we have very similar goals and a vision. We really want to see every family with access to high quality early education. And we support that by actually working with providers on improving their quality, doing one-on-one mentoring for teachers, as well as doing a lot of advocacy work, which brings us here today. Thanks for having me.
And Representative Sterla, I know you're en route traveling, so we're glad that you could join us. If you could just introduce yourself too.
Thanks. State Representative Mike Sterla with the Pennsylvania House of Representatives. Yes, I am en route to provide childcare for 2 of my grandsons who are nearby, who flew in for their parents are going to a wedding, and so we're providing the childcare while they're attending that wedding. Just a couple of quick things. I know in the presentation there was a little discussion about the number of women that have left the workforce as a result of not being able to find childcare, or as a result of COVID, sort of understanding that the jobs they were at such low pay that really it almost made sense for them to stay home and take care of their children instead of being out in the workforce. And so this is something that the state is looking at in terms of the shortage of labor. How do we get people back into the workforce? And the only way we're going to do that is to make sure that they have adequate and affordable health care, or child care, I should say.
Well, thank you so much for that segue, actually, because that goes into our first area. So we're going to have a conversation now with our panelists. Their expertise in their areas are going to be coming out in several different sectors as we look at. And we're going to start off with the importance of early learning and childcare for the child themselves and for the parents. And so this is a question for Kimberly and for Stacy. Can you just explain the importance of high quality early learning centers for the children and for their parents, and also the challenges that are currently happening right now? We saw that Rebecca brought in about the cost of childcare and how challenging that is. So if you would, we'll start with you, Kimberly, if you would be willing to share, please.
Sure. And thanks again for having us and having this panel discussion. But the benefits of high quality childcare are certainly undisputable. I'm sure you've all heard of the benefits before. There's brain research that demonstrates that critical development that children experience before the age of 3 is really the time where their brains are growing the fastest during those first years of life than any other time. And early childhood brain development really depends on quality early learning experiences and relationships with responsive, caring adults that are in high quality programs. And so that's why and high quality childcare or high quality early care and education has been proven to help build a strong foundation for success for children in school and in life. Children also get who have high quality childcare or early care and education opportunities have better health, education and career outcomes. And their parents then are able to achieve higher education. They're able to participate in the labor force and also have higher incomes. So parents certainly rely on high quality early care and education in order to go to work. And so childcare is really that has a dual purpose. And it's obviously in recent years since COVID, it's been definitely increasingly recognized and cited by business leaders as a barrier for individuals who want to return to the workforce. And I'm sure Steve might get into this a little bit more, but many working families, who might be, living paycheck to paycheck, as Rebecca described, really share that common experience of, having reduced hours because of childcare or leaving the workforce altogether. And we have seen that has really impacted women much more than men throughout the pandemic. And just to give you a perspective of the impact of COVID on early care and education, we have seen closures of childcare programs. This data is from the Office of Child Development and Early Learning out of Department of Human Services. But since the pandemic began through October 1st, this is the most recent data we have, over 1,000 childcare programs have closed, 752 have opened. So there is a net loss of 255 programs. And that does not include the 299 programs that are still temporarily closed, but the sector definitely has been impacted by COVID and really, and even before was struggling, but COVID has highlighted that. The sector is also facing severe and deeply concerning workforce shortages right now. High quality childcare, as I mentioned, ensures a child's healthy development and school readiness, but obviously that's predicated on a quality workforce. And so making sure we have a skilled teaching workforce really maintains that high quality early learning environment. In regards to the staffing shortages, Start Strong PA, which is a campaign that our organizations are a part of, conducted a survey back and released the data in September of 2021, where over 1,100 childcare programs participated. 92% of them were experiencing staffing shortages, and 51% said they had at least one classroom that had closed. And they also reported low wages, lack of benefits, underqualified candidates as some of the major challenges to their recruitment and retaining of staff. In addition, we also learned that nearly 26,000 children were on waiting lists with those programs that participated in the survey. Classrooms, like I mentioned, many of them had classrooms closed. So then that equated to more than 34,000 children that could have been served in childcare programs had programs been fully staffed. So that survey really lays out what, where our investments need to lie in terms of our recovery. And those who suffer the most as a result of that are our youngest learners in the long-term effects of programs that cannot maintain high quality due to workforce shortages.
If I could just add here quickly, the discussion about childhood brain development. I've done a lot of work with the topic of adverse childhood experiences, or ACEs, in the legislature, and have initiated some legislation and looked at trying to get some of that tied into our funding formula for schools. advocated with the governor, who actually declared Pennsylvania a trauma-informed state so that we could get training for people. But we know that if a child has 3 or more adverse childhood experiences, their susceptibility to drug and alcohol issues, to homelessness, to divorce, to incarceration is much higher. And when you think about children that are, during COVID, every child had one adverse childhood experience, because that was added stressors to every family at every level, no matter income, where they're located, rural, suburban, urban. And then you add the already stressor that we know of, poverty. So now they're starting out with 2 adverse childhood experiences. So in the idyllic home, it's the perfect idyllic home in terms of no other drug and alcohol abuse, no other factors that are going to affect them. Those children already have 2 of the 3 adverse childhood experiences that start to put them at risk. So what we're looking at is sort of a ticking time bomb for 20 years from now, when all these children become adults, if we do not address some of those factors that play into this. The other thing that was mentioned was the waiting list. And I often, as serving in the minority in the Pennsylvania House of Representatives, I always look at budgets as our priorities. And so it's really tough to see us pass some things that maybe don't address our priorities. But I always look at waiting lists as an unmet priority. And the way I do it, or talk about it, is I said, if we said to somebody who turned 16, who applied for their driver's license and passed the test, and then we said, you know what, gosh, we don't really fund the Department of Transportation the way we should. And so I know you passed your driver's test, but we can't actually issue your license until another 3 or 4 years. People would be outraged if we said, look, I know you filed your income tax return, and I know that you're due a return of dollars, but we don't fund the Department of Revenue the way we should. You're just going to have to wait 5 years to get your refund. People would be out in the streets with pitchforks. But when we say, hey, I know you qualify for subsidies for childcare, but we just don't fund that enough. You're just going to have to wait until your child is not a child anymore and doesn't qualify for childcare because they're already in school. We seem to think that that's an okay thing to do. And I really think that, we need the equivalent of people out in the streets with pitchforks saying, I'm sorry, that's not okay. This is affecting our future workforce, our families right now, our, the welfare of children in the state of Pennsylvania. And it's not acceptable to have a waiting list.
Appreciate your analogies, Representative Sterling, because that makes it more real and tangible to think about the impact. So Stacey, tell us what you're seeing.
Thanks so much. And thanks, Rep. Sterla. Kimberly, I felt like you were describing a day in the life at YWCA Lancaster when you were sharing the results of the surveys that have been done about how childcare centers are being impacted. And certainly our center has felt many of these struggles. Our mission is to eliminate racism and empower women. So on top of providing quality care, we also want to provide that care in a way that makes sense and is inclusive for all of our families, all of our children, that our materials are anti-bias, anti-racist. I want to mention a few things because I think people don't really understand this question of, well, why don't people go work at childcares? There's all these openings. You really need to qualify for these jobs. Not only do you need, a full panel of background checks and mandated reporter training and college credits, or other equivalent training and ongoing training. I mean, this is not someone literally off the street. Anyone can just take this entry level job. Some of these jobs are entry level in their pay, but not entry level in the qualifications needed. And the responsibility that folks have. You know, our childcare parents are dropping off at 7 in the morning and some are picking up at 6 at night. And I know that the kids are only, you know, up a few hours at either end of that day. So the staff that we have are not only meeting basic needs throughout the day, attending to developmental needs, they are pouring their hearts into each and every one of these children. They are with them in some cases more than their parents in a singular day because of work schedules. And I want to just ponder that for a minute. Anyone who has been home themselves with their own child, with an infant, with a toddler, knows how much energy is required. It sounds like Rep. Sterla is about to test his own skills with his own grandchildren. So to do that for work is no easy task. And I really just have so much respect for our staff. The other thing I want to mention is, you know, sometimes the pictures that we see when we're talking about childcare, you know, we see smiling kids, you know, engaged in some activity. Also, we have kids who really struggle to engage in those activities because they have disabilities, because they have delays, because they've had adverse childhood experiences. And so on top of, you know, a day in the life providing care and quality care, we have folks coming in providing specialized services for those children to make sure that they are continuing to develop and getting the support that they need. I also want to just touch on, there are the state of Pennsylvania in particular. I'm going to say in particular because I've worked in about 6 other states. I find the rigor of requirements very high in Pennsylvania. And that's to the good because we want to protect our children. Also, it's not always easy to meet all of those standards. And again, it requires trained, skilled people, real attention to detail, attention to tracking. And the outcome is a parent can relax and go and do their job. And what is so painful for us right now is this terrible cycle that we're in part because of COVID, right? So we are just staffed enough, still trying to hire more. One person gets COVID, they've exposed a couple other people, we have to close down. Now dozens of families are without care. I know that's impacting them. I am sick seeing those numbers that were shared, you know, about the Alice families. And, you know, the domino effect of one COVID case in a childcare setting is just crushing. So we can't ignore that impact and the need to support the staff, have more staff, and still maintain this high quality that's so critical for our kids.
Stacey, you mentioned something that you said the entry level, it's entry level in pay, but not entry level in qualifications for workers in the childcare. And so let's talk about the workforce a bit. Steve, can you share a little bit about the efforts that are being made with relationship to the workforce?
Sure, Deb. I wanted to, you know, Stacey and Representative Sterla both mentioned the she session or female workforce participation. Ready Nation actually partnered with the United Way of Pennsylvania a few weeks ago in releasing a report on this, and I'm going to drop it into the chat if I did so successfully there. And this, you know, this is really just accumulating the data that is out there showing how COVID-19 has disproportionately impacted women's employment, showing that in the first quarter of 2021, female workforce participation nationwide was at its lowest rate in more than 30 years. And, you know, more than 4 times as many Pennsylvania women were unemployed in December of 2020 than were in 2019. And, given what Representative Sterla said about families and women in particularly making that judgment call about, it makes more financial sense for me to not engage in the workforce and stay home with kids, given the price of childcare. Female workforce participation, some are estimating, is not fully expected to rebound to pre-pandemic levels until 2024. So when you think about the workforce shortages that we have right now, a lot of that is being driven by the fact that we have a large portion of the female workforce opting out of the workforce for important reasons like childcare. This was seen more across Pennsylvania. The Early Learning Investment Commission and the PA Chamber did a survey earlier this summer where they looked at 300 Pennsylvania employers. And of those employers that reported losing employees during the pandemic, more than half of them said that it was because of these childcare concerns. So it's a real issue, and it's a real issue that is jeopardizing our economic recovery. So what can be done? What can businesses do? Well, look, I think we have heard reports of individual businesses implementing flexible work schedules, touting to their employees tax-free, the dependent care accounts that the funds for those come out pre-tax on your paycheck. We've heard, not as many as we should, and in fact, it's very rare, but some companies do offer subsidies for workers, and they subsidize on-site childcare for employees. In some communities in Pennsylvania, I know that the Early Learning Investment Commission has worked to bring the business voice together to work on scholarship funds for teacher and quality improvement initiatives in childcare centers. Up in Erie, I know they have the Erie Future Fund, which helps to give scholarships to families for their kids to attend high quality early care and education settings. Some communities are doing establishing local task forces that look into needs assessment so they know what exactly their hurdle or challenge is. And those same task forces are working between higher ed and the early learning resource centers to sort of connect all the different dots there in the community to ensure that they're working towards adequate supply, adequate quality, affordability issues in those communities. But I'll be very clear here. That is all helpful and nice for families who are lucky enough to either live in those handful of communities that are doing that, or they're lucky enough to be employed by a company who is making those types of individual benefits to their employees available. And it is not the majority. In fact, it's a very, very few. So where does that leave the business community? We're in this position of labor shortages all across America. And I think, what we're trying to do through our organization and through the help of the United Ways with their board members that have business interests in communities all throughout Pennsylvania is to bring that business leader voice forward in advocacy efforts around what is on the table with Build Back Better and what is being discussed nationally. The reality is that childcare was in crisis prior to the pandemic, and the pandemic has only exacerbated those crisis points. They operate, as Stacy said, they operate on razor-thin margins. They can only afford to pay their staff relatively low wages with oftentimes no benefits. Some communities have affordability in terms of securing sites to expand, affordability issues, especially if real estate values are creeping up. And I'm sure Lancaster is beginning to fall into that category. There's the issue of parent affordability. There's the issue of childcare deserts. Around 54%, I think, of Pennsylvania communities are actually classified as childcare deserts. And this is particularly relevant when it comes to infant and toddler care. I think if you know any parents out there that are trying to find infant and toddler care for their children, they're on a wait list at multiple locations and they're uncertain if it's going to come through. And then, as was reflected, Representative Sterla talked on the low service rates in the Child Care Works program. I pulled up our collective campaign that First Up and Panacea and the United Way are involved in, Start Strong PA. We have a lot of wonderful resources on our website that give you local data. And just looking at Lancaster County in terms of Child Care Works eligibility, only 15% of families with children that are under 5 that are eligible for Child Care Works, only 15% of eligible children are being served. If you look at infant toddler, it's even worse. Only 12% of eligible children are being served. So, sometimes when I'm talking with neighbors and so forth, everybody knows of, I need to take my kid to the doctor, but we don't have health care. And I find it so tragic that people don't understand on the healthcare side that we live in a state that covers all kids. There's the CHIP program, all kids have access one way or another to healthcare. Well, to the fact that so many families are eligible for Child Care Works and they don't even know it. And now families are contending with rising costs in the grocery stores, rising costs with energy, rising costs with home purchasing or rents. We need to not only solve the wait list, but we also need to be advertising at the state level Child Care Works so that families know that this helping hand is out there. So one thing I want to flip, I won't flip my background physically, but I'll put on our mission readiness side of the equation here. We released a report, and when I'm done speaking, I will plug that into the chat as well. Believe it or not, the largest employee or employer-sponsored childcare system in the nation is actually the military childcare system. And we did a report back in June that outlined, what were the deciding factors that went into the military making key investments in their childcare system for active duty military families. And, the reality is when we came off of the draft of Vietnam and in the early 80s, when you had more women in the armed forces and you had more families in the armed forces where both parents were actually active duty, the lack of affordable and quality childcare became a recruitment and retention issue for the DoD. Does that, that sounds familiar? We're hearing that today in the civilian workforce. So the DoD passed the Military Child Care Act that did a couple key things. They put in place higher pay and a career ladder for the professionals that are serving their children in a teacher capacity. They linked those higher wages to training and improved competencies for those teachers. This drastically reduced turnover. And it was, considered a key factor in improving quality, because that child-teacher interaction is first and foremost the primary measure of quality. Then the military continued to monitor and assess their need for childcare. Now, military is facing shortages in childcare availability even today, but they know they are. They're doing those assessments, and a lot of times they're putting in place multi-year plans to address that. The other important thing that they did was they provided public subsidies for active duty military families. They decided how much a corporal could afford for childcare versus a colonel, and they put in place a progressive fee structure that brought quality childcare within the reach of military families across the board. So these are all the things that we need to be talking about at a high level when we're considering Build Back Better. So I'll stop talking there, but I'll put that other report in there. And I just think, I know we're going to talk about advocacy, but it's so very, very important that people are talking to their members of Congress right now. I find it funny how, well, not funny, but it's just worth calling out that we've gotten to a place where roads and bridges are largely bipartisan. We all want safe bridges. We all want, roads where trucks and commerce can happen and jobs can be created and these port bottlenecks can be solved. That's all well and good. But if the truck drivers don't have childcare, they're not going to be on the road. We need that same bipartisan support for this caring or social infrastructure as well.
Yeah, absolutely. And I just want to also, obviously put a plug in again for Build Back Better. And if you're, interested in doing any sort of advocacy, we do have an action alert just to continue to push Congress to make sure that that gets done. But we talked a lot about the workforce, and I wanted to share some data around what the average pay is for childcare staff. So the average childcare teacher makes $10.69 an hour in Pennsylvania. That is below the national average, and that's based on 2019 data. And then for a preschool teacher, they make $13.96 an hour. So, just to highlight really the critical need for, additional supports and funding to make sure that the workforce is compensated. In many cases, our workforce has the same credentials as, an elementary school teacher, but the pay is dramatically different. And we need to push for pay parity, and Build Back Better will actually begin to address some of that too. So I wanted to share that also. And I also put some links in the chat to a childcare video that Start Strong PA released, as well as some county level data. So you can see what is happening in Lancaster County or other counties around you in terms of staffing shortages as well. So feel free to let us know if you have questions on that.
Thank you, Kimberly and Steve. There is a very active chat with some information in there. We are also receiving questions, so feel free to put your questions in there as well. So Tyrone, you've been waiting patiently. So tell us what's happening with First Up and with up in Harrisburg too.
Sure, and thank you very much. So much like everyone else has said, early education is fortunately at the forefront of a lot of political discussion right now. I think Representative Sterling made a very good point when he said, we address our values through our budget. And we're finally starting to see on a national level, people addressing the value of early education through budget talks with things like Build Back Better. What's really going on right now is two discussions, right? One being on the state level and one being on the federal level. I'll start with the federal level because I think that's the bigger impact right now. And I think that most of us know what's happening with Build Back Better. There's this whole discussion, as my colleagues have mentioned, of this idea of a social infrastructure, a human infrastructure that should be passed. Right now, even with all the negotiation that's been going on in DC, we've seen that the childcare and pre-K pieces have been pieces that have fortunately stayed. We've seen a lot of things be shaved off because of budgetary constraints and some fears of how much debt are we going to incur. But these two things have stayed for all the reasons that my colleagues have mentioned. You cannot bring back an economy if you don't have high quality care and education for our children. And if you don't mind, I'd like to take 12 seconds to divert just to talk about what the importance of high quality is, as opposed to just anybody with your kids. And I take this, and hopefully, I don't know if people can see this. I'm gonna try to put this close to the camera. No, it's not gonna work. Oh well. I was trying to show my hands. I have burn marks on my hands from being injured when I was a child in an unregulated childcare. My parents couldn't afford good childcare. They sent me somewhere that was not high quality, and I was electrocuted. So it's so important to remember that when we talk about this and the funds we're talking about high quality professionals. I believe someone earlier talked about the requirements that are there, the education, the experience. That's what we're talking about, not just a human being that has a heartbeat watching your kids. So with all that said, we are putting a lot of effort into reaching out to our federal legislators. And I do want to make sure people understand there is a difference between federal and state, to really push them to say, what can we do to get this Build Back Better passed? Now, on a parallel track in Harrisburg, some of our colleagues have already talked about the fact that we've been talking with OPDEL, the Office of Child Development and Early Learning, around what can we do to strengthen childcare now. Making sure that we have pushed to get those ARP funds out. to folks. The applications are open and people will hopefully start receiving that money soon. Making sure that, we talk about the compensation issue. And I know that I can probably defer to Kim, who wrote the actual proposal on what we've asked OCTA to look at should Build Back Better be passed, how these funds need to come down and actually pay for our staff. Again, if I could take 13 seconds this time for a personal story. When I first started in this field, when I first started at First Up after giving up my site and moving to First Up, a young man came to me and said, I want to be a childcare teacher. Could you mentor me? He went through a CDA. I was his mentor. He was amazing at his job. And being a man in this field, I know how few of us there are, so I'm so proud of him. I remember him calling me to tell me, Tyrone, I wanted to tell you first, I'm quitting tomorrow. And I was like, well, why? You've been doing this for 2 years. You're amazing. You're on a track to become the lead teacher. What's happening? I was offered $3 more an hour to stock, the back at Target. So if we don't keep pushing for the pay to meet a level that keeps people here. This man loved that job. He hated working at Target, but he couldn't afford to raise his own family on, at the time, it was less than $10 an hour. So what's happening in Harrisburg, we're spending a lot of time speaking with the administration around what money needs to be spent where and where our priorities are. Our priorities are definitely looking at things like, Sarah mentioned the rate list. We want every family to have access, but we're really spending a lot of time this year in looking at how we can compensate our staff in these positions, looking at the subsidy rates and ensuring that we can keep those good providers and teachers open and those good teachers in the field and not leaving for Target, Walmart, and all of our big box stores that are typically paying now somewhere upwards of $17 an hour. So, to Kim's point, even our pre-K teachers who have degrees are still making less than people making our burgers. And I love a good burger, so it's not an insult to anyone making a burger, but it's definitely a real statement of our values that we are willing to pay someone more to cook a hamburger than we are someone with a degree to educate our young people. So because we're talking government perspective, I feel like I should defer to the representative for a minute. So I'll stop talking and defer to the representative if he has anything to add.
Representative Sterla, I don't know if you're in a good place to unmute and to share a little bit more about the efforts in Harrisburg and here in Lancaster that you've been working on.
Yeah, well, I mean, look, we've passed in the last couple of years when we passed additional dollars for early childhood education slots. We have put some in there for the improvement of wages, but certainly not enough. And particularly given the fact that wage inflation and as a result of COVID has really sort of taken this to a new level. As was pointed out, look, when there's a wage shortage, which there has been, those private businesses say, well, we gotta start paying a real wage, or we aren't going to be able to get any workers. And as was pointed out, those workers often come from jobs that are the government hasn't responded as quickly as the private sector has in terms of saying, hey, there's a wage shortage, we better up our pay. We have not done that, and it needs to be done. We've been pushing for increase in the minimum wage to $15 an hour, which has been met with resistance. But even at $15 an hour now, if we said all our childcare workers could make $15 an hour, we would still be at the low end of the spectrum in terms of some of the competition that's going on. Again, as I said earlier, I think we really need to look at this as a priority in our budget to say this is the most important thing. I mean, I referred earlier to the adverse childhood experiences. We know that kids that have those adverse childhood experiences, they're like the combat veteran that had PTSD. Their brains get coated in cortisol on a regular basis because they see their parents in stress. They are in stress. And a child that's in stress their entire life has a tougher time later on in life. I also want to point out the point about the quality of the early childhood education. When we have a STARS rating system in the state of Pennsylvania, and for years it was like, yes, if you just take your child down the street to the woman who takes kids in and watches TV all day long. You know, they didn't have any stars, or they might have 1 star because they did one thing right. You know, they provided a snack for the kids. You get to a 4-star rated child care center, and you have somebody that has an education degree, and you have somebody that, you know, these are top notch. We pay a little more in subsidy for those, but we don't pay a lot more. We need to do those kinds of things also to really incentivize the child care centers that aren't maybe up to snuff to have their employees get up to snuff, because it will get them more dollars to run their child care center. And even then, look, everybody's operating on a shoestring. So we've been pushing for some of that, but in some cases, I've always felt like we're pushing uphill. I know I had one person say to me, well, what we really need is for mothers to just stay home with their kids where they belong. And I always say, okay, so tell that to the Chamber of Commerce that says we need to get women back out into the workforce. You know, these things are at odds, but in an isolated statement may sound good, but when you look at the overall picture of things, we've got to make this a priority in our budget.
Representative Sterla, thank you for mentioning the question of stars, Keystone Stars, Pennsylvania program that not only is kind of a ranking system for parents and impacts the subsidies available, but also is really a map for providers about what quality looks like and how to get there. YWCA Lancaster Center downtown is a Keystone 4-star. And, you know, it's something that we take very seriously, but I also will say I find the state to be very supportive in, you know, nobody likes that site visit when, you know, someone points out where you're falling a little short. But on the other hand, I do like the part where the state has a really clear guidance about, and here's what is required, and here's how we can help you get there. And, you know, so I do applaud the state of Pennsylvania on those efforts, and encourage folks to really consider how stars plays out in their community, how many of what level stars are available, and, you know, how that can guide us going forward, you know, with the hope that we will have more resources for this human infrastructure, and then how we can best deploy those to reach more kids and support more providers.
If I can also add on the child care provider end of things, oftentimes people say, well, you know, I want my kids to go to a faith-based child care center, and I always say, good. And they're like, well, wait, you want them to go to the public child care center? And I'm like, the faith-based child center is a public child center. They qualify for everything that everybody else does, and in some cases have pretty highly rated child care facilities because the church supports part of and subsidizes part of that as their mission. We do not, at the state level, we do not discriminate against faith-based child care centers. In fact, we encourage it. And so I think that oftentimes there is this misconception that that's a separate system. It is not at all.
I'm wondering, since Stacy, we have you on, and maybe Kim, you want to jump in here. We've all been mentioning the subsidized childcare system, Childcare Works, and this is a subsidized system for working families that earn up to 200% of poverty. And I know we've been talking a lot about, well, we need more money, and I'd just like to put a little bit of a moral obligation on this more money. When child care providers get reimbursed for the services that they provide for these subsidized slots, okay? But the state does not pay child care providers what it costs to provide these slots, especially not a high quality slot. In fact, in Pennsylvania, our current market reimbursement rate is at the 45th percentile. And I'm gonna try to explain this, and you tell me if I do it right. I may not. That means that the state pays Stacy's program, if she accepts subsidy, they pay her the market rate that is found at 45% of centers across the state. So the state reimburses her for that service where at less than half of what childcare providers across the state would accept for that service. So we have a moral obligation here to be funding providers at a much, much higher rate. I'm not saying, I don't know that we could ever get to 100%, but we're not paying them what it costs to provide these services. And it's only because they have private pay or other funding streams from fundraisers that they do that they're able to provide these services. So if I explain that right, maybe you can just underscore how kind of dysfunctional that system is.
You're absolutely right, Steve. And it is why you see bake sales or candy bar sales at your child's preschool program. And it is why, as you completely, you nailed it, the private pay clients that we have are subsidizing the rest of the whole, right? And so I don't believe that we are overcharging the private pay, but I do know it has an impact on their budget. And there are folks who are just out of the ALICE framework, that was so helpfully presented at the beginning of this session, folks just out of that who will not qualify for subsidies and are going to be paying, the full rate. So you're right. It's not an ideal situation. And that's what pinches us and holds wages at a certain level and, makes it just so trying.
Yeah, and I'll just add, obviously isn't sustainable as a business. I mean, these are businesses who, need to make ends meet and pay their bills. And it's really highlights the importance of Build Back Better. And I want to kind of pivot to that. Build Back Better will address this issue. It includes an entitlement program. And just to kind of give some details. So if a family earns 250% of the state median income, that they would, and that's about a family of 4 earning less than $300,000 a year, and they have a child that's under 6, they would not pay more than 7% of their income. So this would actually allow, I know Steve mentioned the number of families that are actually eligible for subsidy versus those that receive it. Build Back Better would drastically change that so that probably 9 out of 10 families that are eligible would actually receive support. And that's why it's really important. And it would equate for a typical family, they would save about $100 a week in childcare costs through this. And, this would be obviously phased in over a 3-year period. And states need to opt in to the entitlement program as well as the universal pre-K, which is a part of Build Back Better, but just wanted to share kind of a potential solution that's on the horizon.
And the Build Back Better does a really great job of what I talked about, which is lifting this ALICE population to that threshold. You're going to see that economic multiplier effect. When you have a strong middle class, it benefits everyone. And that's what these childcare subsidies do. It alleviates some of that strain on families to allow them to work with a free mind. They're no longer worried about where their kids are going to be, how they're going to afford their kids' care. So I would definitely say, the Build Back Better package does take a giant step forward to everything we talked about with ALICE.
So we've been hearing a lot about Build Back Better. We want to pivot to additional advocacy efforts. The pre-K for PA, the Start Strong PA, other efforts. And so Tyrone, why don't you start us off in that conversation? Let's also weave in, how can our audience and others get involved in advocacy?
the most important part. And thank you for even asking that. So I'm actually going to start there with two very simple things that you can do, and then we'll kind of snowball from there. And I'll also ask my other colleagues to jump in if I miss anything. The first thing I would say is to literally go to either campaign's website, prek4pa.org or startstrongpa.org, or both, and sign up as a supporter. You'll get alerts from us. Follow us on social media, see what's going on. Because I think one of the most important things that anyone can do is just be aware. And I'm also not foolish enough to believe that every single provider, parent, business leader, whoever who cares about early education has time to read every single article or look at every single thing that's happening. So when you sign up as a supporter, you will get our email alerts for actions that need to happen immediately. You know, we spent a lot of time talking about Build Back Better. And although both of these campaigns have traditionally been state-focused campaigns, really working on our state budget and state allocations, we did a little pivoting to really focus a little more on the federal because we see this great opportunity coming. You know, right now, as we speak, I believe on Start Strong's page, and I'm actually, as my screen is here, I'm looking at Kim Earley, and hopefully she'll type it in for me so I don't, thank you, Kim. The Take Action page, you can actually click and have an automatically generated contact to your legislator be generated for you. You don't even have to know who your legislator is, although I always encourage, please figure out who your federal and state legislators are because you might need them. It's always good to speak to them. All right, so we'll start there. That's the first simple thing that you can do. I also just kind of mention some of the things that the coalition of Start Strong PA and Pre-K for PA have been doing, so you get kind of a holistic view and maybe even inspire some people to think of other ways they can join in. You know, besides just the literal, here's your action. Over the last couple of months, we engaged in a child care tour with one of our senators, our U.S. senators, who wanted to come around and see different child cares in different areas and speak to families. So we helped coordinate that with his office. We said, okay, who do you want to speak to? How? What counties do you need to see? And kind of as we've been talking about this ALICE data, he wanted to see those working families who were in, you know, some people either right above ALICE or right below, you know, right there, and saying, let me hear from real people and tell them what I think so I can get feedback and make sure we match. Those types of things. We've done business leader petitions and letters. You know, Steve Doster, who I know can speak to this really well, leads what we call our grass tops work. That's getting our business leaders to really say, this is important to us as businesses and is important for our economy. This is not just, you know, just because I personally need care, but it's because if you want us to keep this business going, we need our employees to come to work. And, you know, being able to say, who are the legislators at the federal level, who are our Congress people that need a little push or the need to know that the businesses in their area see this as a business issue, not just a family issue. And I think that one of the things we've done well as a campaign is really be able to activate all assets of society. You know, I'm the person who always says, this is everyone's issue, whether you have a child or not. You know, I look at this very holistically. If the business down the street closes because they have no employees, because their employees have no childcare, that affects me. If my school taxes go up because there are more children in special ed who went undiagnosed, who might have been diagnosed and helped through early intervention at a high quality early education facility, that affects me whether I have a child in that district or not, because I'm still paying taxes. So when we talk about our advocacy, we really do try to be very holistic in our approach, grabbing everybody. Of course, every year on the state level, we come up with a PRR, basically a recommendation of what we think needs to happen, where we see dollars need to be spent, what kind of rules we see happening. And it's been said a lot. This year, we're really focusing very heavily on compensation of the field. And if I'm misspeaking for the campaign, someone can cut me off. We believe that the turnover in this field and the hardships that folks are having drawing in new staff is a compensation issue. I am of the personal belief there are definitely people who want to work with kids, or people who love children and want to make their lives work. But at $10.69 or whatever it is an hour as an average wage, when Walmart pays $17, it doesn't make good financial sense to do so. So we've been very cognizant in framing our ask around increased compensation to the providers so they can increase compensation to their workers. You know, and I also just want to mention that I think I saw it in the chat. that when we speak providers, we are very inclusive, whether we're talking family-based providers, group providers, center providers. When we're in the Start Strong campaign, we want everyone to get their fair share of the pie, and we're pushing folks to do so. We're working with providers to mobilize their families. You know, you're taking advantage of this program, share. You know, one of the other efforts that we've had is taking middle-class families who aren't getting any subsidy and aren't providing or aren't getting any benefit from Child Care Works to also step up and say, we want everyone to get the high quality care that we deserve. Again, looking at this non-self, this is advocacy that everyone should take because it does affect us all in some way. You know, obviously, and folks want to know what they can do, starting with those two fairly simple sign-ups. You know, we have a whole list of activities at the campaign that we can encourage people to do. We have something called Leadership in Action, where we literally have tiered things from basically, I have 30 seconds right now, I can do something, that's all I have, to I'm willing to travel with you to actually sit down and meet with one of my legislators. And what I'm very proud to say, because I think this speaks again to the values, and I'm going to keep giving Representative Sterla his props for saying this, you know, you put your money where your mouth is. If your value is somewhere, then you need to show that. We actually do try to provide some kind of compensation, a gift card for folks doing this, because we recognize if you take a day off from work, you then need childcare if you were at home watching your child. If you have to travel to Harrisburg with us, you know, that's gas money. We're trying to make sure that people understand that. So, you know, it can literally be anything from retweeting something and tagging your legislator. It can be something, like I said, as deep as coming to a meeting with us. And I will say that for most of our partners across the state, it's even easier in today's environment. One of the few positives that COVID-19 has left us is the normalization of remote meetings. So not even having to leave work, you can do this on your lunch break, and having a professional who can bring out the stats. I always like to look at Kim and Steve, who are great off the top of their heads with the stats, so that you as a just a community member, a constituent of a legislator, either federal or state, can share your story and have folks chime in with the backup behind it. It's not just you. You're not an outlier. So I'm going to pause for a second and see if any of my colleagues have any extra things they want to put in. But you know, whatever works for you is the way we look at it. We will find a way for you to raise your voice if you were willing to do so.
Yeah, look, I just want to reinforce those comments. That is a great way to do advocacy. Look, if in the legislature, we are constantly bombarded with people. I want this, I want that, I want something else. And so it is helpful to have, you know, a parent that says, hey, I want you to start funding childcare. It also, if those people don't just take the time to do the one letter, but talk to your employer and say, will you do this for me? Will you contact the legislator, whether it's at the federal level or at the state level, and say, we want this, and because my employee needs this in order for them to show up for me to work. Can you talk to your minister and say, can you advocate so that people understand that you have people in your congregation? So think about this in not just, I'm a lone person out here trying to figure out how to get my legislator to act on this. Think of how you can contact people that can say, I'm representing 30 or 40 or 50 people, and I want you to act on this. If you have a child that's in early childhood education, and then you have one that's in school, as was pointed out, ask the principal or the PTA to advocate that represents thousands of parents to say, we want this because we see how it affects us. Those kinds of things. Now, not only have you gotten, you're one person, your one voice has 5 or 6 voices, but those 5 or 6 voices are advocating for hundreds or thousands of people also. And that has a big impact on the legislature. And sometimes I don't think that the legislature, it's easy to say, I got 5 letters. Well, so what? I got 10 letters on a different issue. You know, when you have 5 or 6 people that are contacting representing hundreds and thousands of people, and they get those contacts 10 and 15 and 20 times because they had 50 members of the clergy and 50 school principals and 50 employers contact them. They start to pay attention because that is those people represent, as I said, thousands of people, and it really is effective. But that starts with that one person asking those other people to advocate for them also. You're not in this alone. There's a whole lot of people that should be with you when you do this advocacy.
Yeah, and I would also, it's great, you have the United Way and the YWCA recognized organizations and brands in Lancaster County, making this a focal point of their advocacy efforts. I would also say if you are a business owner or if you're an employee that may talk to your employer, that message should be repeated before the Chamber of Commerce. Chambers are in a unique position to see all of these intersecting inputs of employment and workforce, and they're in a place to they take positions all the time on public policy issues. And part of our effort is to be educating, informing local chambers of commerce so they understand the issues that we're talking about. And besides, look, childcare is a small business within itself. So it's an entire sector of their businesses that they should be representing. And childcare is a public-private model sector. So, to say, well, all childcare should be handled by private sector, well, that's just not the system. So I would encourage everyone to be also talking to their chambers about the importance of childcare.
I just wanted to share too some of the things that we will be advocating for, coming up with for the 2022-2023 state budget, just to kind of give you a perspective of what us as advocates are looking to do. So on the pre-K side of things, so for pre-K counts, which is the state's state-funded pre-K program, we are advocating that program serve 107,000 more eligible children that are currently not served. We talked about that kind of unmet need. We're also going to be advocating for an increase for the rate of reimbursement for pre-K counts. And then under Head Start Supplemental Assistance Program, we're advocating for a rate increase there. And these are the rate increases obviously are really to pay for the cost of care, to make sure that the cost of care is covered for these programs. And both of those cases, the cost of care is not covered, particularly for infants and toddlers, which is the highest cost due to ratios, in most cases. On the childcare side, we are advocating for additional infants and toddlers to be served. We're also Steve mentioned the staff compensation. And then we're also looking for an increase in credential and degree attainment opportunities. And that's really to help those who may not have the credentials and the degree to get into programs such as there's a TEACH program, and then there's also Rising Stars, as well as professional development organizations that offer those degree attainment opportunities so that individuals can be eligible to work in programs. And they could obviously do that while they're in these programs. But increase the number of folks that have access to that. And then also advertising the Child Care Works program, which is the child care subsidy program. And we talked a lot about that today, but the Department of Human Services does not advertise Child Care Works. And so many families don't even know that it's out there, that they could get assistance with paying for childcare. And so really advertising it like we do CHIP. I mean, everybody knows about the Children's Health Insurance Program, but so something similar to that. And then also making sure that we're maintaining the funding for childcare subsidy so that's not cut or reduced, that it's level funded so that we can get the numbers back up in childcare subsidy back up to what they were before pre-pandemic. The number of families being served in childcare subsidy has decreased over the last year, and I'm blanking. I don't have the numbers at the top of my head. I don't know if Steve or Tyrone you remember, but there has been a decrease in childcare works enrollment.
And I think it's important to note that that decrease is probably due to two major factors. One being, obviously some families have not returned to in-person work yet, so they may not need the service. But the other factor obviously also being that, a lot of places are open but are shutting down classrooms because they can't find staff. And I think that's an important thing just to remind folks of. The other thing that I also like to remind folks of is this is a temporary thing. When we see the decrease, I'm fully expecting that we're going to see a huge increase as we keep getting a handle on this COVID-19 situation. I feel fortunate that every day there seems to be some kind of good news along with the bad of how things are moving along. But as more businesses open, as more people are returning to in-person work, I definitely see a need for increased childcare. So those numbers that are a little depressed right now, the bubble's going to burst, and we're going to see this huge influx of families needing care. And the piggyback on what Steve Doster said about the chambers of commerce, this is commerce. I mean, these are small businesses, but it just makes so much sense to recognize that if your business can't get their employees there, if you're the owner, you're going to be in deep doo-doo, as they say, right? So another thing I'll just mention, another opportunity that I'll put first up out there for is we are happy to do presentations to business owners around the importance of early education and how it affects your business. We also have 10-minute modules for parents to kind of understand how to understand the system, because there isn't as much advertisement around CCW and what it means, or even how to find a high quality care. What does this look like versus just the random person down the street who may or may not be doing great care in their home. Because like I said, we have some great family providers. But what's the difference between a licensed family provider who has obtained quality versus just somebody who says, drop your kids with me? We are definitely open to help businesses inform their staff and inform business owners on ways that they can advocate as well to really ensure that their business will be stable because their employees can come to work.
Well, folks, we are wrapping up with time. Steve, did you have something you want to share here?
Yep, real quick here. One other element of advocacy. Look, 2022 is a big election year. Everything from a U.S. Senate seat, open seat in Pennsylvania, to Pennsylvania governor, to midterm congressional elections. You're probably going to have a lot of people knocking on your door, handing stuff out. Ask them the simple question: where's this candidate stand on childcare and early learning and pre-K? And raise it as a campaign issue, because it starts there. It starts before they're even sworn into office. So just we will, our campaigns actually have a C4 arm called the Children Matter Action Fund. And we will be getting more intensive with that C4 side of the equation in the coming months. So we will be putting stuff out on that and easy ways to engage on the electoral side. But that's a huge opportunity as well.
We have had a 90 minutes filled with lots of education and calls to action. And so I want to thank all the panelists for being present today and engaging. We want to thank the audience for being here. But we also want to say now's the time to also be stepping up. So if you're not involved, please reach out and get involved with the resources that were given. Thank you, everyone, for being here. I hope you have a wonderful weekend. Bye.
Thank you.